Well, welcome everyone. Thank you all very, very much for coming. I think before, I've got a couple remarks to make. I'm going to be brief and introduce the panelists who really have the deliverables today. But I think before we do that, I'd like to ask everyone who can to stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Well, you know, in the last Congress, we passed the PAC Act, which was a major piece of legislation, probably the greatest expansion of veterans' health care benefits in the history of the country. And when we did that, it became law. I had a couple of town hall meetings to impress upon veterans the importance of signing up for the PAC Act. And it was so successful that I said, I want to make sure we do one of these in every county in the district. And today we're doing one here in Lake County. So the fact is that the meetings become a little bit more than just PAC Act focused. We've got folks from the VA here who will both not only answer questions, but help people sign up for either the PAC Act or to work through other issues that they may have. So I want you to keep that in your thoughts when as we go. I want to thank the County of Lake for allowing us to be in this wonderful chamber with air conditioning. Matthew, thank you. You did well. And I want to thank my staff who work so hard on veterans issues all the time, but work to put these town hall meetings together. Brandon from my Santa Rosa office, Myra and Luca from the Napa Lake office. And without any further ado, I think what we'll do is just go right down the line, and we'll hear from our guests who know veterans issues inside and out, and who really break their pick to make sure that those who served our country receive the benefits that they earned. And I think that's a very important distinction. So we'll start with the clinic director from Clear Lake, Julianne Macri. And Julianne, you're up. Thank you.
Thank you so much. Oh, thank you for the tech support. I appreciate it. Hi, everyone. I'm Julianne Macri. I'm a physician at the Clear Lake VA. I'm also the medical director there, so I'm responsible for a lot of our operations on the clinical side, especially the primary care side. I think there were slides, but I don't know where they're going to go. In progress. Okay. That is fine. So I want to talk to you a little bit about the PACT Act today. With the disclaimer that I work on I work for the VHA, the Veterans Health Administration. So I am really, my primary role is as a doctor, and as a doctor for the veterans of Lake County. And a lot of the nitty-gritty about benefits questions should actually be directed to the VBA, the Veterans Benefits Administration, which I think many of you probably know. Nancy and Saul, who I know do a great job of helping everyone out in terms of navigating those systems, which are really complex. I want to do a quick overview of the PACT Act, which is very exciting. It was something that helped really expand services to veterans by making it so that, I don't know if my slides are up yet, by making it so that more veterans, oh, I can control it.
There you go.
Amazing.
You're in control.
I'm in control. Let's see. Oh, there we go. That's me. Wonderful. Okay. By making it so that more veterans would be eligible for VA services particularly if they had exposures to toxins in the military. It also provides more research around some of those exposures, which I see personally for especially a lot of the younger veterans. There's a lot of newer exposures like burn pits where we're still really early in understanding the health implications that those will have long term. It makes it easier to process claims and strengthens the VA's workforce, which is really important. This is too small almost for me to read, so, but I think the big thing here is to help understand that veterans who were exposed to toxins in the military are going to become eligible for more services through the VA. This is pretty specifically defined by specific locations, specific time periods, and specific exposures to toxins, which is why I really encourage you, if you have specific questions about your personal situation, to go out to the front lobby there where Billy Montgomery, who is our clinic's member services person, and then Justin from the VBA are there with a lot of resources and can answer your specific questions. So a TERA, which is a toxic exposure risk activity, is specifically defined by the law, but the ones that I see really commonly among the veterans who come into our clinic are things like air pollutants, so burn pits, particles, oils, dusts, fuels, other chemicals such as pesticides, other things that you might have come across in your occupation, such as asbestos or certain foams, solvents, radiation, and then warfare agents like nerve agents and chemical and biologic weapons. This is not a comprehensive list. This website that they cite, the publichealth.va.gov/exposures, is a really, really excellent source of information. I actually reference it a lot myself because there's tons of details about things that I'm also learning about each day. If you think that you're eligible for VA healthcare, you should definitely apply. We would love to see you in our clinic. We would love to be able to take care of you. Billy Montgomery at their member services can help you navigate this system, and there's some resources as well. And I'm happy to share this with others afterwards.
Shouldn't everybody apply?
Everyone should apply.
Yeah.
Yeah.
You should tell them just to make sure.
Everyone should apply, because a lot of people don't realize that they're eligible, and the folks at the local vet office are really good at helping you kind of understand the things that you might be eligible for. I also want to just make a plug for the VA, which is something that I personally care about a lot and know a lot about more personally. I think that we really do provide truly excellent care. If you look, they've done studies where they compare people who get their care through the VA and people who get their care through the private sector, and VA consistently outperforms the private sector in terms of getting people's blood pressure under control, treating cancers early, detecting cancers early. It's also a relative to our private healthcare system. It's a much more affordable option, and for many veterans, it's completely free. So it's a really great service that we can provide. So definitely don't wait. Go sign up for care, and we'll be happy to care for you. I want to provide just some updates about the Clear Lake Clinic, because I'm sure many of you already know about it or maybe have heard some things about it. We're excited to have been, in the last couple months, we've welcomed some new providers, which is really exciting. So we now have 2 providers that are there face-to-face. And then myself and a nurse practitioner do video visits for the most part, though I'm often there in person as well. We have 2 psychiatrists who are on site and a full-time psychologist on site. We've also started a program where we're bringing UCSF trainees up from the city so that they can learn about the issues facing rural veterans, and they can be providing care to veterans in rural locations. It's been a really well-received experience, both from the patient side and from the trainee sides, where I think a lot of doctors in training don't really get exposure to what it's like to provide rural health care and what kinds of problems you all face when you live, hours away from, a specialty center. So that's a really exciting thing we're doing. We're also doing a lot to expand telehealth and virtual services because, as you know, it's hard to get specialty care up here. So we have video to clinic options where our VA-based or San Francisco-based providers will call in. A lot of those providers are, world-class clinicians who are affiliated with UCSF, and they're providing care over video to Lake County veterans. We have a lot of specialty services that do that. We also do telederm, teleaudiology, nutrition, social work. And then, as many of you might know, there's been an expansion into Santa Rosa of more services with a new clinic that opened up at Santa Rosa. We call it Santa Rosa South, which is a new clinic, and that's allowed us to use the old clinic in Santa Rosa to provide specialty care. So we have cardiology, pulmonology, neurology, surgery, audiology, yep, everything. We have a whole bunch, and every month it's like more and more services are coming up there. So that's been very exciting too. And we're starting to bring some specialists to Ukiah as well. So we have a surgeon and a orthopedic doctor who both come up there periodically and see veterans. So we're really doing a lot within the VA to try to bring the care out to you because I live in Sonoma County, so I know how hard that drive is. And I can only imagine how much harder it would be if I had, chronic health issues or chronic pain. And so we really want to bring the services to you so that we can provide the best care where you live. That's our clinic. That's the phone number. And then these are sort of all the institutions that are part of our network, the San Francisco healthcare system, where we are providing services from slightly south of the city all the way up to Eureka.
Julia, thank you very much. And I'm remiss in not mentioning the fact that VA healthcare is really good. And I'm a client myself. I'm a combat wounded veteran, and I get a lot of services through the VA, and they just do an outstanding job. And the Santa Rosa Clinic North, I know the reason I said it was, and they had audiology is because I go quite often. So you guys do really good work. So thank you. Next, we'll hear from Sergio Cheo, who is the Veterans Benefits Administration from the Oakland region, and more important than that, he's an Army veteran. Thank you for your service.
Thank you, sir. Good afternoon, everyone. I am as he said, the director of the Oakland Regional Office, which is responsible for this area. We are responsible for 44 counties in Northern California. We have 3 regional offices in California. This is the state that has the most regional office of any state in the nation. We have San Diego, Los Angeles, and Oakland. When I first came here about 2 years ago, we were paying approximately $280 million a month in benefits. As of last week, we're now paying $393 million a month in benefits. And I attribute a lot of this to the PACT Act, which we are going to cover. That's what we're here for today. So really quick, I really want to make this quick because I want to make sure that we have time for all your questions. That's what we're here for. So what is PACT? What does it stand for? And it's the Promise to Address Comprehensive Toxics Act of 2022. It was signed by the president in August of 2022. It went into effect in January of 2023. We started processing claims, and since then we have received 1.7 million claims under the PACT Act and completed 1.4 million claims. There are 3 groups of veterans that are mainly affected by the PACT Act. Those are the Gulf War era vets, as well as the post 9/11. And as you can see there, and I know Juliana, she was making some references to specific locations that are covered by the law and the time frames. And so you can see it up there. For those that served in the Gulf War and post 9/11, it's specifically referring to folks that served after August 2nd, 1990. And then you see all the locations underneath that. And then for folks after post 9/11, all the locations underneath. And I'll explain a little more about that and why that is unique. The other group of veterans that it impacts are the folks that were affected by Agent Orange. One of them is Vietnam. There are a lot of benefits already available for Vietnam veterans. The PACT Act added 2 new conditions, one of them being hypertension, which is the most commonly claimed condition. The other one is MGUS. Doctor, you can probably explain. I don't know. I don't see many of those, but that's the other condition that was added. Other things that were changed by the PACT Act were the locations where Agent Orange was used. It was not just Vietnam. Prior to coming here, I was the director of the Honolulu VA Regional Office, and I had jurisdiction for veterans that resided in the U.S. territories, Guam, American Samoa. Every time I went there to do town halls like this, veterans would swear up and down that Agent Orange was used at those locations. But until the PACT Act, Agent Orange was not recognized as being used there. Now, it is, and any veteran that is affected by any of the Agent Orange disabilities and that resided in Guam during those years specified there, 1962 through 1980, gets the same benefits as any other veteran that served in Vietnam. And the last group is those that were involved in radiation cleanup. There were 3 specific events that were added under the PACT Act, and you can see them on the screen. So let's talk about conditions, presumptive conditions, and what is a presumptive condition? So for service connection, there are 2 things that we're going to look for. First, was there an incident in service? Is there anything in your service treatment records that show you were treated for that condition while on active duty? 2, actually 3 things. 2 is, do you have a current diagnosis? And the third is there a link between your current diagnosis and your event in service? That's direct service connection in a nutshell, and that's what we see the most. However, presumptive takes away the need for the disability to be shown on active duty. So if you served in one of those locations that were shown earlier under the 9/11 or the Gulf War, and you currently have one of any of these disabilities listed here, you're automatically presumed that the disabilities as a result of your exposure to toxics while on active duty. So it doesn't have to show. So take, for example, brain cancer. Your service treatment records could be completely negative for any treatment or mention of brain cancer while on active duty. But you have brain cancer now, and you served in the Gulf, we're going to presume that the disability is because of your service, and therefore we're going to service connect it and grant benefits. That's what presumptive means. Filing claims. A lot of folks were denied benefits prior to the PACT Act. And we're encouraging everyone to submit a supplemental claim. It's basically a VA Form 200995. I don't want you to memorize any of these forms, etc. I think that's what Nancy is here for. Our county VSOs know the law. They know what it takes. They know the necessary forms that it's going to take to file a claim. So please use them. They're free. You can also go through va.gov to file a claim online if you feel comfortable doing that. You don't have to see anyone. By the way, va.gov also has all this information in there. It has all the presumptive conditions, the locations, and like I said, you can file directly from va.gov, file your claim in with us. Let me see, and of course, obviously for folks that have never filed a claim for any of those presumptive conditions, that you will file what's called a new claim using the VA Form 21-526EZ. This doesn't only affect veterans, it also affects survivors. So if the veteran passed away based on one of those disabilities that we just listed, the survivor can also be entitled to benefits, all right? What if I've previously been denied? File a claim, all right? And that is my slide, really short, but we're going to be here and look forward to answering all the questions that you may have.
Sergio, thank you very much. And our next speaker probably doesn't need an introduction because, as Sergio said, the VSOs are rock stars. Any of us who've had to go into one of your offices know how valuable you are and are very appreciative of the help that you've provided. So Nancy, it's all yours.
So I doubt there's anybody here that doesn't know me. So like Sergio said, I didn't bring slides. But as Sergio said, you don't need to remember the claim form numbers. You can go on va.gov and file a claim. Call me. I'll make it easy for you. I fill the forms out for you. All you have to do is sign them. That way, it's on me if I get it wrong. I do my best not to. We do have a high number of Vietnam vets in Lake County, so we have filed numerous claims under this PACT Act for hypertension, specifically a couple for MGUS. And I am so glad to hear that there are more staff at the clinic. So I'm basically here for questions. I'm here to answer your questions.
Well, that's a good lead-in. Let's do questions. So if you have a question, raise your hand, and Luca will come by with a microphone, and you can ask it.
Thank you, Luca. My name's Skip Hewlett. I'm 100%. Anybody see 60 Minutes Sunday night? It was about PTSD in children. And I'd really like to hear a lot more about that. I think it's too late for our kids, the Vietnam vets, but I say this for the Iraq, Afghanistan vets. Their kids are going to go through a lot of what my son went through. So please, have you got any thoughts on that, or say more about it?
So the benefits right now are available for the veterans themselves. I'm not familiar as far as, compensation for the children. Is that what you're asking, sir?
I think the point is that the fallout from veterans service, especially veteran service in combat, is a lot broader than maybe we accept or are willing to acknowledge. And clearly, there's been a lot of externalities of war that our kids have suffered as a result. And I don't know that there may be some services that are available, but there's a lot more, I think, that the VA can do and that Congress can do to understand that, starting with making sure that we figure out how not to go to war.
Juliana, are there counseling services available for family members?
We do offer family therapy, We do offer family and couples therapy within the VA system. So that is a resource that veterans can tap into. And I think it's another, I'm an internist, so I treat adults, but I'm mindful and think about the ways in which the conditions that my patients might have spillover effects to their spouses, their children, the other people that they're around. And I think it's another really good reason to seek care. And I've actually seen veterans come in because they realize the effect it's having on their families, what they're struggling with. I'm not sure if I'm directly addressing your question, sir.
Well, basically, I'm hoping that in the future there will be counseling or some type of help for the children. I wasn't talking about financial, just somewhere where they can go and say, hey, Dad or Mom is a little bit different.
Understood.
You're absolutely right. And I was just talking about that with Justin on the way here, who is a combat veteran. And it's not just the veteran that gets impacted, it's also the spouse and the children. They all get affected by that. So I do understand what you're saying, sir.
Any other questions? Any comments?
Sorry, sir.
Okay. I just wanted to make a comment on our PTSD group. We do the VVC, the VA, the Video Connect, and we're having problems with that website. And our therapist has not been able to get any help. So I want to encourage you to reevaluate what's going on with VVC, please. The other question I have is came up in our group was that they're eliminating phone appointments. And I want to know if this is true.
Yeah, I can address both of those questions. So I use VVC a lot for appointments, and I know that it's a very, it's not as smooth and easy to use of an application as I wish it was. Is the person who runs the PTSD group Melissa Flores? Dr. Flores?
Negative.
Okay. If you want to come to me afterwards and tell me who's operating that, I can reach out to them and see if I can offer some help.
Dr. Megan Smith.
Megan Smith. Okay. And then for phone appointments, no, we are not eliminating phone appointments. I know that that's a really critical way for people to access care, especially when they have difficulty leaving home for whatever reason. I can just say as a physician, there are also definitely benefits to me being able to see a patient. I do a lot of virtual visits, but even when patients come into the exam room, there's a lot I can get done. I can listen to your heart, I can listen to your lungs, I can do a really close up in your ears or on your skin. So I do find that I can provide better care when patients can come in, but I also know that it's not always possible. And so our goal is to meet people where they are.
It's a real hit in rural areas if you discourage that, so.
I have a question.
I'll put in another plug too, is that we also have something within the VA called the Digital Divide Consult. The goal is to help people who might not have access to broadband internet, might not have an internet service provider at home. Basically, the VA issues you a iPad or a device, tablet that you can use that has its own internet connection that you can use to have video appointments with your providers. And they do a lot of training too. So if you're having trouble logging on or your sound isn't working, there's a bunch of people that are employed to help you navigate that.
On the technology side of the first question, are there things that VA needs to do, or the things that I need to alert the VA to make sure these connections are smoother? And
What do people in the room think? I think.
Yep,
Yeah.
indeed.
I think it is a common problem.
okay, well, we should
Yeah.
we should figure this out, and I have no problem going to VA and making sure they address this.
Perfect, thank you.
Nancy, you had something you wanted to say?
I have a question for Sergio. So I understand that we don't have the contracted examiners, so veterans have to travel for their claims exams. Is there any outlook in the future, especially for audiology, that they be able to use the clinic audiology exams in support of a claim rather than making them travel and having a new hearing test when they just had one?
So I'm assuming that the provider here is very far away, and that's why you're asking this information.
Concord.
Correct. And so the way that the system is I think VHA tried to, it's been a while now, about 4 or 5 years out, decided that, they were kind of shorthand staff. They needed their doctors to concentrate on care. And therefore, the VA had to come up with a contract to take care of the CMP exam. So most of the CMP exams are now being conducted by contractors. The problem is that not every location has doctors, especially when it comes to specialties. As I mentioned earlier, being in Hawaii prior to coming here, we had to fly veterans from Guam to Hawaii to get CMP exams, some CMP exams, because we don't have the specialties in those islands. And so, but to go to your question, ma'am, I really don't know what kind of capacity is available at the clinic here. I will take it back to,
Well, I mean, I've had veterans that come in and want to file for either hearing loss or an increase. And they come and they say, I was just at the clinic. And they said my hearing loss is worse. So I filed the claim and then they have to go to Concord for another hearing test. And they just had one.
and Nancy, there's no way to obtain those results from that test results?
VA does. They get Capri records.
And then you indicated that the veteran just had an exam? All right. The only thing I can think of is maybe the speech recognition test or some specific metrics were not looked at for the exam purposes that we need in order to evaluate. And that's why we need an exam. It's the only reason that I can think of that. But I would strongly encourage you, especially if it's a claim for increase, to make it very clear that you have private evidence or VA evidence that you want considered as part of your claim. Also, private DBQs. Just on Friday, there was an update to the manual encouraging all the VA folks to make sure that we're using the private DBQs when available. So what does that mean? Your provider, there are certain exams, CMP exams, that can be completed by your own provider. And so there are specific forms that Nancy would know about, and you have your provider fill it all out and submit it in to us, and we are going to consider that as part of your claim most of the time. It's the same exact form that your CMP examiner is going to use, except it's filled out by your provider. And so if we can get that from you, then there's no need to send you to Concord or wherever it is that we need you to send you to.
I get the feeling and with a lot of the elderly, especially the elderly in Lake County, that it prohibits them from filing for increases because they don't want to do that travel again for CMP exams. Therefore, that's where, because hearing loss is a big one. That's where my questioning came from. It seems to be, and somewhere I could feel that question.
No, I appreciate that, and I'll take it back. Like I was explaining to you earlier, we do not, the system decides where to send the claim to for the exam. Our employees don't know where all the physicians are. There's a system that, depending on what type of exam it is, and the zip code where the veteran lives, it automatically tells you this is the closest CMP examiner for that exam, and that's where it sends you to. But I don't know as far as, I'm assuming obviously we have some audiologists at the clinic, and what I will ask is, I heard this at the town hall, what are the chances of of doing some CMP exams at the clinic? I can certainly look into that.
I recently had a veteran that went to Gilroy for a CMP exam. Gilroy.
Nancy, I'll raise that issue too in Washington, so if you
It's
get.
like, are you serious? And my question was, and did they offer to pay for your hotel room? Because you can't do that in a day drive.
So if you share that information with my staff, I'll run that out in DC.
Okay.
I think these situations are really challenging. What I'll say about the VA, the Clear Lake VA clinic capability is we definitely have audiology services and we can do audiology exams. I think there's a difference though in the mindset of what we do versus what a CMP examiner is going to do. We have the mindset of trying to provide you care. Or that's our goal, is to make your life easier, to make you feel better, to get you healthier. So an audiology exam that we do in our clinic is going to be focused on that. It's going to be focused on how do we best treat your hearing loss? How do we figure out the causes of your hearing loss? How do we fit you for hearing aids that are going to be effective for you?
I wondered if that was.
Which doesn't always directly one-to-one translate to the questions that need to be asked for determining if this hearing loss is service connected.
Correct, so.
And I think that's where there's often, that's where I think it's so hard for veterans to navigate our system because it doesn't make sense. We're all the VA, we should all be doing the same thing, but we do have different roles within the VA.
No.
And our role is not benefits.
And I would think though, Juliana, for claims for increase, that the evidence used by the VHA should be able to translate to what we do. I mean, there is the initial service connection where we have to have a medical opinion unless you show hearing loss while on active duty. what the CMP examiner does is provide a medical opinion as to whether your current hearing loss is related to your military service. And that's why usually you have to go to a CMP exam.
Because we don't do that. We don't have access to your military records. we're not trained in how to do that.
But once that is established, once the conditions establish a service connection, then the only thing that we are doing after that on claims for increase is just looking at the evaluation. And the evaluation is based on specific audiology metrics that
Right.
Wasn't that Nancy's question? Veterans who are already found to be service-connected, they get another hearing test, and the hearing loss has increased, but then they're told they have to go to Concord, or in this case, I guess Gilroy, to be retested.
It was insane.
Yeah, my impression of that is that there's no reason that the veteran or the VSO couldn't request the records from the VA, because you all have access, you all have that, it's a right, it's a legal right you have to your own medical records, and then submit that as evidence for your claim. There's no reason you can't do that. If your hearing loss has gotten worse, please talk to our medical records department, get the information, pass it on to Nancy.
Not only that, make it very clear when you file the claim that you just had an audiology exam done in VHA, because we have access to those records too. So if we know that you had an exam done recently, we're going to look at those records first and see if it's sufficient for us to grant an increase. If it's not, then we do have to schedule you for an exam. We can't deny you without the exam. But so we can grant, or if not, we have to schedule you for an exam. Hope that makes sense.
So my question wasn't just out of the top of my head. This has come up numerous times with clients that come in, well, why do I have to go do this when I just had this test? So I'm hoping that that answered a question for quite a few people and can be passed on.
Yeah, most of the time is because the veteran has been separated from active duty for many, many years. And so in those cases, unless it's a presumptive condition where you don't have to show any evidence of treatment in service, say you had a back strain while you were on active duty in the 1960s. Now in 2024, you have degenerative disc disease. Is the degenerative disc disease a result of that lumbar strain that you had in the 60s? That requires a medical opinion. And that's why a CMP examiner is usually needed to provide a medical opinion.
My question is how come we don't have better communication between the vendors that the VA send veterans out to, and they get services, and that information from those services never get back to our PAC team doctors with the clinics? And there's a big disconnect between the services that is rendered outside in the PAC Act, by the way, part of it, for the veteran, and the information dealing with the veteran's condition never gets back to the VA where it can be a part of the veteran's record. That seems to be a real problem. The other question that I had, I know it's a little bit off the beaten path, but are we going to talk about the homelessness in this county? The veteran homeless. I'll refer that. Thank you.
I can take the first question. I feel you, because I feel that frustration every day along with you all. It's I think like any healthcare system, honestly, it's big, it's unwieldy, it's difficult to manage. And when you have, the VA does a really good job of communicating within providers within our system, but when people go outside to another system, it can get really challenging. So here's just an example of, say I order an MRI for someone to be done at Adventist Health because they can't go all the way down to San Francisco. I do this all the time. We have to do a whole coordination back and forth with Adventist where we send them an authorization. Everything gets done by fax because healthcare is pretty behind the times in a lot of ways. So we get them the authorization. They then schedule you, and they're the ones that are responsible for telling us when they scheduled you. But say you schedule for 2 weeks from now. Say something comes up, and then, it has to get pushed back a month, either because of something with you or something with the Adventist MRI machine is down. So our team will check those records on the day it was supposed to happen, but then it didn't happen, the records aren't there, and it kind of gets pushed to the back of the queue, and then we don't really know when it actually did happen because we never got that information. It's a very classic problem of two systems that don't communicate with each other. I think about this problem all the time because it drives me crazy, right? I care a lot about what's happening to my veterans. I want to know when they've gotten a scan so I can give them information as much as possible. And I sometimes don't get that information. Also, when I get that information, it's not in an easy-to-read electronic form. It's like scanned in as a PDF that's attached to a note. And so I have to go into another system to open that note. None of this is the right thing. I'm not saying it should be this way, but it is this way, unfortunately. Probably the best advice I can give you just as a veteran is to be your own advocate in the system. One of my favorite things is when veterans call and let me know that something has happened. Hey, I got my scan done, Dr. Macri. Can you give me the results? It makes a huge difference because it cuts out those 20 middlemen in the process, and then it's just more about you and your provider does care about that. So that's the advice I can give you, like kind of concrete advice. I think bigger picture, there's probably a lot that needs to be done on more of a legislative level to make healthcare systems more interoperable with each other. And I have seen improvement in that in the time I've been at the VA, but it's tricky.
I think, excuse me, I'm not on that policy committee, but as I recall, there was a tremendous amount of investment that was needed to get VA technologically up to speed. A lot of that's been done, but I think there's still a ways to go.
Yeah, I agree.
And then what about the homeless issue?
The other thing I'll say also is for any of these concerns that you have, I really encourage you all to reach out to the patient experience office when there is a concern, like VVC links aren't working, or my provider didn't get my MRI result, in time, in a timely manner, because those behind the scenes, what happens is those complaints get filed away and they get pushed to the right people in leadership. And when they see, 50, 60, 70 complaints about the same thing, that issue gets more airtime. It kind of rises to the top. So that's the other thing I think that is very valuable to do.
Veterans homelessness?
So we have 2 homeless outreach coordinators, but we rely mainly on the medical centers for the homeless, whether it's placing a veteran in a home, et cetera. We don't do that. What we try to do is get the monetary benefits as quickly as we can, and homeless is one of the claims that get prioritized among with terminal veterans or veterans over 85. Those are three tiers of veterans that get prioritized anytime that claim is flashed as homeless. Of course, we rely on the claim itself for the veteran to say whether or not he's homeless, or or the CVSO or whoever helps the veteran file that claim to identify it as a homeless claim. What that does is it triggers specific folks in the office to specific folks that are going to manage that claim. They're going to try to contact that veteran if the veteran has a phone number. If they do contact the veteran, they're going to work really closely with the veteran to ensure that they report for the CMP exam that we've been talking about a lot, because one of the challenges that we have is for the veteran to show up for those exams. Now, a lot of folks forget that there's also a pension benefit, not just compensation. And a pension benefit is not, pension is instead of compensation. Compensation is basically monetary benefits for something that was incurred while on active duty. Pension is monetary based on an income need and a disability. So it doesn't have to be related to your military service. It is a little less money, but what we're looking at is the veteran disabled, and 2, does he meet the income threshold for it? And we can grant benefits. So don't forget about that. It's not just compensation, there's also pension, and we should be talking to our veterans about that.
And that is And that is for war-era veterans only. Peacetime just do not qualify.
Yeah, one of my major concerns is about the homeless veteran population in Lake County. Lake County serves over 7,000 vets plus because we have people that are migrating here all the time. And one of my major concerns is that we need to start looking at putting a veterans home here in Lake County. At one time, Congressman was talking to County of Lake, and County of Lake was looking at providing some land atop 18th Avenue for a veterans home, transitional for other services, which would have accommodated the need, some of the need. It would have started the process. Now what we have here is migrants of veterans that are coming from all over California, coming to Lake County, impacting a system that is already major impacted for the veterans that live right here in the community. So what I would like to hear is some kind of commitment to work with the Congress or whomever in Washington, D.C. to try to get some money so that we can build a homeless, a veterans home right here in Lake County to serve the veterans here and the massive amount of population that's coming in that's impacting the system.
Well, I can
Thank
tell
you.
you that I don't know that there is a veterans home in the near future for Lake County, but there are veterans home type programs that could possibly work in Lake County. We've got a great one down in Rio Vista. They've built actual residential homes on property that was owned by, I think it was donated property, but it's adjacent to the Veterans Hall there. And they accommodate a number of veterans who live there. They're in the process of building a second home. In Sonoma County, they've provided a couple of different options for homeless veterans, but not a home per se. Now, there's also vacant beds in the California Veterans Home in Yountville. I was just with the director of that home last week, and she said they had beds available. So if there are people who are interested in getting into there, I'm more than happy to help. So I'm more than willing to help facilitate any of that if the county and if Lake County wants to pursue that.
Now, the other thing is, what about the veterans that have lived here for over 40 years and they get into a situation where they're being evicted from the homes that they're in, and they're having those kinds of issues? I mean, it's not actually fair that we have to uproot and move to some other area that we're not familiar with, leave our kids, leave our families, and leave our friends. There's nothing fair in that process, Congressman.
No, it's a terrible situation. There's no question about that. Homelessness in general is a terrible situation. A large part of it is a mental health issue. There's a lot of work that needs to be done in that regard. We're never going to fix the mental health problems that we have unless there's a huge investment into mental health. And we can't keep putting Band-Aids on the symptoms that show up with mental health. The investment needs to be on the front end, on the brain research to figure out why this stuff is happening. And that's an effort I'm involved in Washington. And I think that's the only way that this is going to be solved. And I'll just mention to you, we had a situation in my Santa Rosa office where someone brought a veteran in who had been living on the streets in Santa Rosa for 10 years. And he said, this guy's a veteran, he's been homeless for 10 years, and the reason is he can't get health care. He had a health problem. It precluded him from being able to work and just disrupted his life. And we got involved in that. We got him working with VA. We got him the health care he needed. He got his health care issues fixed. We got him temporary housing. And within a very short period of time, he was employed. He had his own house. And shortly thereafter, he got married. So it was a real success story. Sad news is they're not all success stories, but it can happen.
Yeah, the other thing I'll just add is that we do, I have a lot of patients who are homeless, and we do have a lot of services for that at the VA clinic. We have a social worker whose whole role is to help veterans who are either currently unhoused or at risk of becoming unhoused, to help stabilize that situation. His name is Will Van Sant. He's not physically in Clear Lake, but he's basically like, if you or anyone you know is facing those issues, please come into clinic and ask for help, because we can get you his cell phone number. He's done amazing things for our veterans in terms of getting them shelter that night, houses or apartments or places to stay more permanently within weeks to months. So we also have Sheila Rockwell, who's our HUD-VASH social worker, who does a lot of really hands-on case management with higher risk populations that are eligible for HUD-VASH vouchers. So I think I would just say, let us know if those concerns exist, because there actually are a lot of resources that are maybe not as visible as a veteran home, like not as easy to see, but I've gotten a lot of veterans housed.
My name is Doug Sherseth, and I have been in the VA system since 1967, my first relapse of malaria. I've had a lot of things to go on within the VA system. I've seen good people, I've seen not so good people. One of the things that's going on at this particular point with what I would like to address tonight is my travel pay has been a nightmare for the last 2.5 years. Luca's working on it right now, and there's some others that are working on it. And hopefully the 2 hours I spent before I came here tonight with an individual down in San Francisco might help eliminate that. But I'm not the only one. I'm finding out that it's not just systemic to the San Francisco area, but it's around the country. And the nightmare that comes up is when you are denied, when you've been given your travel benefits for 20 or 30 years, and all of a sudden you go to your dashboard and you try to follow the rules now that we don't have the Kievs to file in your claim, and it says you don't have any travel benefits. So there's a benefit, and they call that a P on a plate. Those of you that are in mental health know that you get too many P's on the plate, it tends to overflow the plate. What I've been asking for the last 2 years, I've been trying to do this on my own, and I finally went to the offices here to get some help. And I think we're going to get some inroads in it. But I suggested this a long time ago. The technology that we have today, and I know the VA is behind a lot of different things, is that when a veteran checks into a clinic or he checks into San Francisco, a fair distance away from here, uses his own transportation, the cost of fuel is extremely high. It's a burden to try to pay that on your own, and you're not getting your travel pay going through. So on a technical basis, it would not be too hard, I think, to have a staff come in and program, like a key that Sherseth just checked in. Okay, he's going to see Dr. Westfeld today, or he's going to see Dr. Latigue down at the pain clinic. That particular check-in, are you still living at the same address? Has anything changed? No, it's all the same. A keystroke can now get that payment to that individual rather than having to go through filing a claim, filing a form, having to fight the system, spending hours on the phone. I spent 3 hours today on the phone, either in waiting or in talking to the individual in San Francisco. That's another P on the plate. And you get too many P's after a while, you can't handle it. And as we get older, it's more difficult to get all these things sorted out, and we need some help that can get to the base of the problem. After talking to the individual in San Francisco today, he said something to me about a cell phone number that when you check in, you can show a QR number or whatever, and that automatically sends your claim in for travel. Has anybody heard anything about that, and can you expand on that?
Everyone's looking at me. You are not alone, so I can definitely say that, and I share your frustrations with that because there's nothing more. Well, there's a lot of things that irritate me, I suppose, but when a veteran, or I think the other issue that comes up frequently is the VA, when the VA is providing travel and they're supposed to come pick someone up and then they don't show up. I think that's another concern I hear about a lot. I am not directly involved in that process, but I know that a lot of veterans like you have raised similar concerns, and I know that there's been efforts to work on that. There's been a couple work groups that I've been tangentially involved in on that. I don't know the details because I'm not involved in any of the travel claim stuff. But I think it's actually a really good example of the power of a lot of voices and a lot of complaints. So when that happens, every time that happens, like calling patient experience, I mean, that was what caused there to be a work group and a lot of efforts around this.
I appreciate what you're saying, but let me interject one thing if I can. I've been through all the things that you just talked about. As a matter of fact, poor Billy over here has blood running out of his ears half the time when I do talk to him. It's been going on for a couple of years. I had a heart attack 2.5 years ago, and I had had a stent put in. I've had my intestines explode. I've had malaria 5 times. I've been through the VA system and a lot of different things. And for a while there, things were running fairly smooth. In the last couple of years, this whole thing has gone upside down when it comes to this travel issue. Now, there was an individual in San Francisco that lived up here in Lake County that put in hours and hours of extra time. And Greg had a heart attack. But the person that took his place couldn't do 3 times the effort that Greg would do on his own time. And so she ended up quitting. And then at first I thought this was a problem with just San Francisco because Greg wasn't there. But I've learned since that time, it's much more widespread than we can possibly imagine. And I think this comes right down to what Mike has in his privy is to get to the VA system and say, why can't we set up a programmer to set up a system to where when we check in, it's a key punch rather than all this hoopla that we have to go through. And at my age, I'm trying to keep things in order, and I'm up to my elbows in all these alligators, and it's hard to remain, to drain the swamp. So this is why I'm here tonight, just to throw that little key in there. There's a lot of other problems that we have to address, but I'm looking for that one address tonight. Thank you.
The good doctor and I are going to get that information to the VA.
We'll let them know.
Thank you.
That's a great idea. I mean, if you showed up for your appointment, travel pay. Click.
I'm going to continue on with the travel pay.
Oh, gee, Skip.
I sent in, I had 11 travel claims that just never heard a thing. And actually, I wrote to Congressman Thompson, and Luca gave me a call. And within 2 months, checks started coming in. And since we caught up, and thank you, Luca, and thank you, Mike, fill out your travel claim and take it to Nancy. She'll fax it. Done. It's just an extra trip. It'd be nice if they had a keystroke. I'm not waiting on that. I'm going to take it to Nancy.
You're welcome to bring anything to me. I will submit to the VA. Whether it be healthcare, VBA.
So what's the magic touch, Nancy? What are you doing about those travel claims that get paid so quickly?
Okay.
It's called the Nancy Luca magic.
Is that what it is? Okay.
It's called stick it in the fax machine, nudge the paper through, and walk away.
I don't hear about this. This is a good system. I'll pass it on for Greg.
My name is Charles Fowler. My complaint generally is that I feel that the VA is very disrespectful of my time. And for instance, we've changed the phone system to Clear Lake, and it seems like there's no way to get directly to anybody in Clear Lake. So if I call for whatever, to get a prescription renewed or to get an appointment or whatever, I'm going to have to go through this, whoever answers the phone, and sit there until they call me back, which may be many hours or not even the same day. And on the travel pay, I've finally figured out how to get through the website, and it works, but it's not something that's user-friendly for somebody that didn't grow up with computers. And
Call me and we'll do a conference call and we'll get whatever you need whenever you need it.
well, my problem is to try to get into the clinic. That's just wrong to not have some way to call directly to the clinic. And I've worked out the travel pay. But someone should have. There should be somebody available that knows. I called for help on it several times, and no one was able to talk me through it. I finally got somebody that knows more about computers that helped me, but that's just not, it's not user-friendly, and it's not the way it should be.
I totally understand it. I agree here. That's another concern I definitely hear a lot. The background for that is that our system moved to a centralized call center. The reasons, and so that call center covers the entire VISN, and the VISN is like Northern California, Nevada, the Pacific Islands, Guam, Hawaii.
We don't like it.
A very extensive network. The reasons for doing that is because when any given clinic had like staffing shortages, or if it's after hours or over the weekends, it's very hard for, there might be a clinic that's understaffed and they can't answer their phones at all. So if you centralize something, there's always someone that you can reach. However, that someone might not actually know how to solve your problem, which is where the frustration comes in. I find the call center also frustrating. So even though I understand why they did it, I also understand why it's very challenging. The secret tip I can give you is to call the Clear Lake number, press option 2, and then press option 4. That will get you to one of the medical assistants at the front desk.
I tried that the last time. I was told that, and it didn't work. And in the past, before they modernized the system, when there was an overflow, it would forward to some central location. But the people that are sitting down there, a lot of times not all that busy, ought to have the first shot at taking the phone call. That's
right. Yeah. So if you did that after hours or when the clinic was closed for a holiday or the weekend, it would still go to the call center, because the idea is that we don't want a veteran waiting on hold for 15, 30 minutes because the local staff is all out sick that day, right? We want to get you connected to someone sooner rather than later. So that's my best advice. The other piece of advice I can give is, this doesn't always work for computer savvy people or less computer savvy people, but the secure messaging, My Healthy Vet is a really useful tool. It works pretty well. It's like the online portal. And if you get signed up for the premium version, you can order your meds. You can send a message directly to your team. You can send a message to your specialist. That sometimes is an easier way to get your questions answered. And I have some older veterans who maybe can't manage that themselves, but they have a trusted caregiver, family member, child, niece, friend who kind of helps them navigate that. And I've had that work well for people.
You can call our office. We have, in the VA computer system, we have what's called Teams. And it's an instant chat. It's like text messaging, but it's instant. And if I have you on the line, I can Teams the Clear Lake Clinic, and somebody will respond to me almost instantly And all I have to do is say, hey, can you please give Mr. So-and-so a call? This is his number.
My name is Dennis Cox, and I have two things I want to address. First of all, several years ago, I was working as a fuel truck delivery driver, and I was delivering fuel to the yacht home, old veterans home. And I'd done it 2 or 3 times, and I asked the fellow, the maintenance guy, I said, which one of these tanks I'm filling up, because there are several different sites, gives electricity to the retired and old veterans there, and he goes, none of them. I left a message over at Fritch Hall to get a hold of your office. I was wondering if you ever heard about this. I didn't think so. So that's still going on over there when we get power shutoffs and they have no power to the veterans over there that are in the facility for care still don't have electricity. Did you look into that? I will. Thank you. My question about the healthcare issue. Nice to meet you, Doc. That's my doctor. I've never actually seen her. But yeah. So yeah, she can't confirm or deny. I can. We're good. We just met. So anyway, 90% disability does not give me dental care. Why is that not happening? So I feel that I'm being persecuted because I'm not 100% disabled. Maybe I'll never be 100% disabled.
It would be nice to see that lowered to like 70%.
And there's an effort in Congress to do that.
So-
It's just, it's not an easy
We're
lift.
working on it.
Okay, go.
Somebody else?
Paul Snyder, and I'm I was exposed to toxic water at Camp Lejeune. I'm just wondering how the PACT Act relates to that, because I've heard conflicting information about whether it expands any conditions that are covered for Camp Lejeune, toxic water.
So so Camp Lejeune is a completely different, aside from the PACT Act, that has already been addressed separately. Those claims have been centralized to one specific office. They're all processed by the Louisville regional office. And it's because it requires, they want to make sure that we're processing those claims consistently for every veteran that was affected by Camp Lejeune, but there is definitely benefits for that, sir.
I have printouts on Camp Lejeune and the disabilities that go with that. But Camp Lejeune's a totally different animal than PACT Act.
Yeah, that's what it looks like. It just I've seen conflicting information about that online, misleading, I think. So.
Yeah, online's not, yeah. Contact the office. I did put a stack of business cards down there.
VA.gov also has a lot of information on Camp Lejeune, sir. I would rely on just the VA.gov website. Yeah.
Yes, I wanted to address the transportation issue. For 2 years after, just right after COVID, I have been submitting transportation invoices through the VA system. They lose paperwork. Nobody knows where nothing is. The claims never get paid. And all I got was a runaround for close to 2 years. I finally went to Billy, God bless him. But even he was running into difficulty trying to figure out what they did and what they didn't do. All I know is that I was never reimbursed for several. He managed to get me 1 or 2, but the other ones they lost. And lucky for me, I did have the backup documents from where I went to the visit, and I got sign-offs on the visits. So when he resubmitted those, I'll probably never see that money, but I think that's very unfair to the veterans when they have to shell this money out of their pocket, because we don't get a lot of money. We're just barely making it as it is. if you could look into that, see if you can make the system a little better. You know, will I get mine or not? You know, understand? At this point, it's irrelevant. But I just want to make sure that something be done about that in the future.
Well, if you're owed money, it's certainly not irrelevant. So on your particular case, you've got Luca and Myra right there. You can give them your contacts and we can look into that. And clearly, there's never a shortage of improvements that we need to make in VA or in every other program.
One of the things that I have seen on the transportation is I've had veterans bring in 2 or 3 checks that they receive for travel pay. There's no dates on them. They don't know what check is for what travel. So they may have submitted 10, received 3 checks, and they don't know what it's paying.
Anyone else?
So I was told a while back that community care was a bygone thing of the past for our community, that I could no longer take advantage of community care referrals.
No.
I'm not sure who told you that, but that's definitely not true. You should make an appointment with me. We can chat about it. Happy to try to help.
Well, I was getting community care for a couple different things, or in the past, and then they told me, no, for my skin, I use Humira, and they made me go. I had to run down to Miley and go see the dermatologist, and that's been kind of a pain in the butt. They send medicine, it gets hung up in the post office, blah 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 blah, all kinds of stuff, and so I was told when I was making the full switch over to the VA system, it's kind of like, I have PTSD behind government issues, government, but I'm getting past it. I'm working on it. The VA does have a pretty good system.
Yeah. So community care, most Lake County veterans are eligible for community care because of drive time and distance, just because of simply how far it is to get to certain specialty services. The exceptions would be if we can provide the service at our clinic. So for certain things like audiology, we don't really approve community care for that because we are providing it. And I had mentioned that we're providing more virtual care as well. And so because of some of the concerns about communication between our system and external systems, I personally feel like veterans get better care when they get care within our system. But if you are, if you have a dermatologist or a cardiologist that you've been seeing for years that absolutely knows you the best and you want to continue care with them, you have a right to opt into community care.
Well, thank you all very, very much for coming. Thank for all the veterans who are here. Thank you for your service. To all the veteran family members who are here, you're part of that service, so thank you also. And to our panelists, let's give these panelists a good hand. Thank you for coming tonight, and thank you for everything you do every day for veterans. Thank you very much.
You guys rock. Thank you, Mike.